Shock refers to a medical condition where there is an inadequate supply of oxygen and nutrients to the body's tissues and organs. This can lead to cellular dysfunction and damage if not promptly treated. Shock can be caused by several factors, each leading to a common outcome of inadequate tissue perfusion and oxygen delivery. The primary causes of shock divided into 6 types: hypovolemic, cardiogenic, septic, anaphylactic, neurogenic, and obstructive shock, or hypovolemic shock. This type of shock occurs due to a significant decrease in blood volume, typically from hemorrhage due to trauma, surgery, gastrointestinal bleeding, such as hematmesis and melena, and other conditions like abdominal aortic aneurysm and ruptured ectopic pregnancy, or severe dehydration from burns, vomiting, and diarrhea. Cardiogenic shock. This results from the inability of the heart to pump effectively, often due to conditions such as myocardial infarction, severe heart failure, or arrhythmias that disrupt normal heart function. Septic shock. Caused by a severe infection which called sepsis that triggers a systemic inflammatory response, leading to vasodilation and low blood pressure. As we talked in previous video, anaphylactic shock occurs in response to a severe allergic reaction, leading to widespread vasodilation, airway constriction, and systemic effects like low blood pressure. You can check anaphylaxis video in our channel. Neurogenic shock that results from spinal cord injury or severe brain injury, causing vasodilation and low blood pressure due to disrupted autonomic nervous system control. Obstructive shock. Caused by mechanical obstruction of blood flow, such as from a pulmonary embolism, that lead to blockage in the lung arteries, cardiac tamponade, which mean compression of the heart by fluid or blood in the pericardium, or tension pneumothorax, that mean air buildup in the chest cavity. The symptoms of shock can vary depending on the type and severity of the condition. However, some common symptoms that may be present in different types of shock include rapid heart rate. The heart beats faster to compensate for decreased blood flow and maintain organ perfusion. Low blood pressure. As blood flow to the organs decreases, blood pressure drops, leading to symptoms like dizziness, lightheadedness, or fainting. The pulse may be weak and difficult to detect due to reduced blood volume and cardiac output. Increased respiratory rate helps to maintain oxygen levels in the body due to reduced tissue oxygenation. And decreased oxygen delivery to the brain can result in confusion, disorientation, or loss of consciousness. Poor circulation can cause the skin to feel cool and clammy to the touch. Also, reduced blood flow can lead to paleness or a bluish tint in the skin, lips, or nail beds. Some individuals may experience gastrointestinal symptoms like nausea or vomiting as a response to shock. Finally, in severe cases of shock, kidney function may be compromised, leading to reduced urine production and dark-colored urine. The investigation of shock involves a comprehensive approach to identify the underlying cause, assess the severity of the condition, and guide appropriate management. Here are the common investigations conducted for shock. First, clinical assessment. Monitoring vital signs like blood pressure, heart rate, respiratory rate, and temperature to assess the severity of shock and guide treatment. Then, physical examination. Evaluating skin color, capillary refill time, mental status, and signs of organ dysfunction, such as altered consciousness, respiratory distress, and decreased urine output. Laboratory tests. First, complete blood count, assessing white blood cell count, hemoglobin levels, and platelet count to detect infection, anemia, or bleeding. Then, checking electrolyte levels, kidney function by creatinine and blood urea nitrogen test, liver function by bilirubin and liver enzymes test, and finally lactate levels to evaluate organ function and metabolic status. You should also check arterial blood gas, assessing oxygenation status, acid-base balance, and carbon dioxide levels in the blood to guide respiratory support. Finally, check for abnormalities in blood clotting, especially in cases of bleeding or disseminated intravascular coagulation. Imaging studies. Start with chest X-ray, examining the lungs for signs of infection, fluid accumulation to detect pulmonary edema, or other respiratory conditions. Then abdominal ultrasound or CT scan to evaluate for abdominal causes of shock, such as internal bleeding, organ rupture, or obstruction. Also echocardiography to assess heart function and detect structural abnormalities or cardiac tamponade in cardiogenic shock. Specialized tests. Blood cultures to identify the causative organism in cases of suspected infection, especially in septic shock. Focused assessment with sonography for trauma, rapid ultrasound examination to detect free fluid like blood in the abdomen or chest, indicating internal bleeding. Electrocardiogram to assess cardiac rhythm and detecting signs of myocardial ischemia or infarction in cardiogenic shock. Hemodynamic monitoring. Invasive monitoring such as central venous line or arterial line to directly measuring blood pressure, central venous pressure, cardiac output, and oxygenation to guide fluid resuscitation and vasopressor therapy. The treatment of shock depends on the underlying cause and type of shock. Start with general principles. Airway, breathing, circulation. Ensure an open airway. Provide supplemental oxygen or mechanical ventilation if necessary. Establish and maintain adequate circulation with IV fluids and medications. Monitor vital signs. Continuous monitoring of heart rate, blood pressure, respiratory rate, and oxygen saturation. Intravenous access. Establish large bore IV access for rapid administration of fluids and medications. Specific types of shock and their treatments. Hypovolemic shock. Start with rapid infusion of crystalloids like normal saline or lactated Ringer solution. Blood transfusions if the shock is due to significant blood loss. And also you should control the source of bleeding. Approach for surgery, control pressure and hemostatic agents. Cardiogenic shock. Give inotropic agents like dobutamine to improve cardiac contractility, vasopressors like norepinephrine to maintain blood pressure, and diuretics if there is fluid overload. Mechanical support devices may be needed like intra-aortic balloon pump and ventricular assist devices. Revascularization procedures like angioplasty or coronary artery bypass grafting. For septic shock, give broad-spectrum antibiotics as soon as possible, IV fluids to restore intravascular volume, and vasopressors like norepinephrine if hypotension persists after fluid resuscitation. For anaphylactic shock, give epinephrine intramuscular immediately, IV fluids, antihistamines like diphenhydramine, corticosteroids, and beta agonists like albuterol for bronchospasm. For neurogenic shock, give IV fluids, vasopressors if hypotension persists, and atropine for bradycardia. In obstructive shock. For pulmonary embolism, give anticoagulation like heparin and thrombolytics, or surgical embolectomy in severe cases. And for tension pneumothorax, needle decompression is needed followed by chest tube insertion. For cardiac tamponade, pericardiocentesis is needed to remove the fluid around the heart.